The pandemic has been hard on everyone, but especially on those who rely on Medicaid for their health care. Medicaid is a program that provides free or low-cost health insurance to people with low incomes, disabilities, or certain health conditions. But a rule that was meant to protect them during the crisis is about to expire, and millions of people could lose their coverage. The rule was passed by Congress in 2020, when the pandemic was raging and millions of people lost their jobs and incomes. The rule said that states could not drop anyone from Medicaid, even if they no longer met the eligibility criteria, such as income limits or residency requirements. The rule also gave states extra federal money to help them pay for the increased enrollment. But the rule will end on March 31, 2023, and states will have to resume their normal processes of checking people's eligibility and renewing their coverage every year. This means that up to 15 million people could be kicked off Medicaid in the next 12 months, according to a report by KFF, a nonprofit research organization. Some of them may have found other sources of income or insurance, but many others may still need Medicaid to afford their health care. Losing Medicaid could have serious consequences for people's health and well-being. They may not be able to access their regular doctors, medications, or treatments for chronic conditions. They may face large medical bills or debt if they get sick or injured. They may also have to choose between paying for health care or other basic needs, such as food or rent. The people who are most likely to lose Medicaid are children, young adults, and people of color, who make up a large share of the program's enrollees. These groups already face health disparities and barriers to care, and losing Medicaid could make them worse. Some people who lose Medicaid may be able to get other types of health insurance, such as through their employers, the Affordable Care Act, ACA, Marketplace, or other public programs. But not everyone will qualify or be able to afford these options. Some states have not expanded Medicaid under the ACA, leaving millions of people in a coverage gap. Some people may not know about their options or how to enroll in them. And some people may face challenges in applying for or maintaining their coverage, such as lack of internet access, language barriers, or complex paperwork. States and the federal government are trying to minimize the disruption and help people keep their coverage or transition to other sources. They are sending notices and reminders to Medicaid enrollees about their renewal deadlines and eligibility changes. They are providing assistance and outreach to help people understand their options and enroll in them. They are also extending special enrollment periods for ACA plans until July 31, 2024, for those who lose Medicaid. But these efforts may not be enough to prevent millions of people from falling off the Medicaid cliff and losing their health care coverage. This could have devastating effects on their health outcomes, financial security, and quality of life. As the pandemic continues to pose challenges and uncertainties for many Americans, losing Medicaid could be a disaster they can't afford. One of the consequences of the pandemic is that millions of Americans could lose their health coverage through Medicaid. Medicaid is a program that provides health insurance to low-income people who meet certain eligibility criteria. Medicaid is funded by both the federal and state governments, and each state has some flexibility in how they run their program. During the pandemic, the federal government gave states extra money to help them cover the increased demand for Medicaid. But there was a catch. States had to agree not to disenroll anyone from Medicaid unless they moved out of state or died. This was called the Continuous Enrollment Policy, and it was meant to protect people from losing their health care during a public health crisis. But now, as the pandemic eases, some states are resuming their normal process of verifying eligibility and removing people who no longer qualify for Medicaid. This could affect up to 15 million people across the country, according to a report by the Urban Institute. The report estimates that about 10% of the current Medicaid population could be at risk of disenrollment in the next few months. Who are these people who could lose their Medicaid coverage? They are mostly children, young adults, Black and Hispanic people, according to the report. These are groups that have historically faced barriers to accessing health care and have been disproportionately affected by the pandemic. Some of them may have become eligible for Medicaid during the pandemic because they lost their jobs or income, but may not be aware of their enrollment status or how to renew it. Others may have experienced changes in their household size or income that make them ineligible for Medicaid, but may not have reported these changes to their state agency. Losing Medicaid coverage could have serious consequences for these people and their families. They could face higher out-of-pocket costs, delayed care, or foregone care for chronic conditions or preventive services. They could also face more financial hardship and medical debt. And they could contribute to the spread of COVID-19 or other diseases if they cannot access testing or treatment. What can be done to prevent this mass disenrollment from Medicaid? The report suggests several strategies, such as extending the continuous enrollment policy until the end of the public health emergency or beyond, simplifying and streamlining the renewal process for Medicaid beneficiaries, providing more outreach and education to inform people about their eligibility and enrollment options, coordinating with other programs and agencies that serve low-income populations, expanding Medicaid eligibility to more adults in states that have not done so under the Affordable Care Act. These strategies could help ensure that millions of Americans do not lose their lifeline of health coverage during a time when they need it most.